Hello, my name is David Painter. I am with the Ohio Department of Insurance. My division within the Department of Insurance is called OSHIIP. We're here today to do a Welcome to Medicare presentation. We're going to cover a lot of great information for those of you who are transitioning into Medicare for the first time, or perhaps those of you who have been on Medicare for a while and just would like a refresher or some more information. Next slide. OSHIIP stands for the Ohio Senior Health Insurance Information Program. We are a premier federally funded program for Medicare education in Ohio. We provide this education in a number of different ways. We have speakers like myself who go out and do these presentations to the public. We have our publications. We have our hotline number, and our hotline is available 1-800-686-1578. That is Monday through Friday, 7:30 to 5. Those are answered by folks right here in Columbus, Ohio. We also have our online appointment, and there will be a link on the screen for that as well. And in addition, we partner with a number of community groups. We have a number of OSHIIP volunteers who have taken a Medicare certification training. They get an update training every year, and they are there if you're looking for possibly meeting with someone face-to-face. Not over the phone, not over the computer. You want to meet with someone face-to-face. However you interact with us, just know that all information we're going to give to you is 100% unbiased, meaning we don't have anything to sell, promote, or endorse to you. We are here just to help the consumers get the proper information and to make the best decisions for themselves. Next slide. So our first slide here gets into it, says, what is Medicare? Federal insurance, I think most folks know that. Federal health insurance for folks, 3 different groups actually qualify, 65 and older. Now, that's what we typically think of with Medicare, right? Folks who have reached age 65 or older. And that is by far the majority of folks on Medicare. You can be on Medicare prior to age 65 if you are disabled. And here we're talking about Social Security disability benefits or Railroad Retirement Board if you happen to be a retiree of the railroad. With Social Security disability benefits, after 2 years after Social Security has deemed you disabled, you will then be eligible and signed up for Medicare A and B regardless of your age. And then the third bullet point there, any age diagnosed with end-stage renal disease, which is end-stage kidney failure, or ALS, which is of course better known as Lou Gehrig's disease. Folks with those conditions can also sign up for Medicare prior to age 65. Then we have this option 1, option 2. Everyone on Medicare is in one of these 2 categories. There is no exceptions to this rule. You're either over here on this option 1, original Medicare A and B. You may or may not have some sort of a secondary insurance. Hopefully you have some form of Medicare Part D, or you're over here in this Medicare Advantage, kind of an all-in-one package. So most of what we're going to talk about in this video are these pieces. What they are, how they work together, and how to reach out to impartial resources like OSHIIP and our Medicare certified volunteers to make smart choices here. Next slide. So applying for Medicare. If at age 65, you are already getting a monthly cash benefit from Social Security or Railroad Retirement Board, again, if you happen to be a retiree of the railroad, you don't have to do anything to sign up for Medicare A and B. The Social Security or the Railroad Retirement Board will go ahead and sign you up automatically. You will be enrolled in your A and B on the first of the month that you turn 65. For everybody else, maybe you haven't taken your Social Security early. Maybe you're still working. You can still sign up for Medicare at age 65. The sign-up age for Medicare has not changed, still age 65. And there's this 7-month initial enrollment period. It's the 3 months before your 65th birthday, the month of your 65th birthday, and the 3 months after. We always recommend that if you need your benefits to be in place when you turn 65. So if today was your birthday and you needed your Medicare benefits to take place, to be in place for your birthday, the 3 months before is the time to do it. Sign up ahead of time. Your benefits would have started the first of the month, even if that was not your birthday. Next slide. Applying for Medicare, and you can see here, we have the address up there to do it online at Social Security, ssa.gov. Now, it's very important with these websites that you go to a .gov, That means you're on a government site. The full address there says /benefits/Medicare. If you do just go to ssa.gov, one of the buttons you can hit there is Medicare. It'll bring you a drop-down list. One of the things says apply for Medicare. You can also do it in person at the Social Security office. We do recommend calling ahead. Calling ahead, finding out if the office that's most convenient to you is taking appointments. If they are, make an appointment. If they're not, at least find out what's the best time for me to go. Is there a slower time a day? Is there a slower day a week? We do have the national number up there for Social Security. You see the 800-772-1213. Now that is answered from 8 to 7, again, Monday through Friday. And there's the hearing impaired line there as well. You can see on the screen. Next slide. Couple things to consider at age 65. This really comes back to the main question we get for folks who are becoming Medicare eligible for the first time. Am I required to sign up for Medicare when I turn 65? And really, it depends. This first bullet point is a big exception for a lot of folks. If you have a current employer's group health plan, either from yourself or your spouse, you can delay that enrollment into Medicare. Now, let me back that up. Current employer group health plan, current employer. Either I'm working or my spouse is working, and whoever it is that's still employed, that's where my insurance is coming from. Cannot be a retiree plan or a private plan or something like that. It has to be an employer plan, and the person who is the employee has to still be employed. So if it's my own employer, I have to still be working. If it's my spouse's employer, she has to still be working. Has to be a group health plan offered by the employer. Can't be if you are someone, for example, who is self-employed and you have a private insurance plan, or you have an insurance plan through the healthcare marketplace. In those cases, you would still be expected to sign up for Medicare. COBRA is not going to count. COBRA is insurance. Once you have left your employer, they're going to offer you your insurance benefit for a period of months. It's generally pretty expensive to be on COBRA. It is also not going to count for Medicare because, by definition, if you have COBRA, you no longer work there. Healthcare savings account. Now, this is one we do want to hit. A lot of folks have that as their employer coverage. Healthcare savings account, basically you're putting in money. Perhaps your employer's putting in money, and you can use that money to pay for your medical expenses. Once you have started Medicare, any part of Medicare, you can no longer contribute to an HSA. We actually recommend 6 months before you're ready to start Medicare, you should stop contributing to the HSA. It is just a tax issue where the money's going in, not taxed, coming out, not taxed. And once you're on Medicare, create some problems. So we strongly recommend, if your coverage is an HSA, stop contributing to it about 6 months before you're ready to sign up for Medicare. What's in there is still your money. You can still use it and take everything out, but just stop putting more in. Marketplace, again, that is for folks who don't have insurance through an employer or something like that. They might have signed up on the healthcare marketplace. And retirement insurance, again, is not going to count as current coverage. The only way you're going to be able to delay signing up for A and B, again, is if you have a current employer group coverage, either yourself or your spouse. Next slide. All right, so now we're really getting into it. There's the Medicare card, the red, white, and blue card. You can see there it says Hospital Part A, Medical Part B. So let's break this down a little bit. Part A, your hospital coverage, we always say, think of it as your inpatient care. Inpatient. So inpatient in the hospital, inpatient in a skilled nursing facility, home health care. Now for Medicare, we're talking skilled home health care. So we're talking part-time, intermittent nursing, physical therapy, speech language therapy, something along those lines. And hospice care. Hospice is end-of-life care for folks who are terminally ill. All covered under your Part A. If Part A, hospital, we want to think of as inpatient. Part B, medical, let's think of it as outpatient. First thing up there, outpatient services. So that is anything you were doing at the hospital as an outpatient. That can be anything from, of course, the emergency room, outpatient surgery. Sometimes there's appointments just at the hospital, x-rays, tests, all that good stuff. covered under Part B. Your doctors and providers are covered under Part B. So this is going to be just your regular doctor's appointments, nurse practitioners, physician's assistants, all that good stuff. Preventative benefits we're going to touch on here on the next slide. And then durable medical equipment. Durable medical equipment is actual equipment that we sometimes need to keep us going at our best. So things like oxygen supplies, walkers, wheelchairs, CPAP machines, things like that, diabetic testing supplies that we sometimes need to keep us going at our best, all covered under Part B. You can see the 2 bullet points there on the bottom says Medicare was never intended to pay 100% of your healthcare costs. We're going to talk about that as we keep going. And Medicare generally does not cover non-medically necessary services or care outside of the U.S. in most cases. We'll address that as we keep going. All right, next slide. Medicare preventative benefits. These are, once you've started your Medicare Part B, a series of, or I shouldn't say a series, a number of tests, screenings, vaccinations, things like that you can get generally at no cost. Generally, Medicare is going to cover 100%. The first examples we have up there are the vaccinations: flu, pneumonia, hepatitis B for some folks, COVID-19 vaccines are still covered at 100%, not paying for a thing. Couple different types of exams, a Welcome to Medicare exam, and then every year, the Welcome to Medicare is going to be your first 12 months that you're on Medicare Part B. And then every year, whether you've done the welcome or not, you're eligible for an annual wellness check. And they use diabetes testing supplies as one of the other things on there. There is a complete list at medicare.gov. Again, remember the .gov. That is going to list, all the preventative benefits. Once someone in your home is on Medicare, you will get a book in the mail from the federal government every year called Medicare and You. It's a pretty thick book, but it is a good reference, particularly for things like this. If you want to look up how often can I get screened for diabetes, that book is a good reference to look that up. Of course, you can also do it online at medicare.gov. Next slide. We'll briefly talk about vision and dental, and we'll kind of circle back around to it here in a little bit. Traditional Medicare, what we're talking about right now, original Medicare A and B, is not going to cover routine vision dental services. It's going to cover things related to disease, things like cataracts, glaucoma, things like that. There are some plans out there that you can buy that are going to vision dental, sometimes vision dental hearing plans that work with original Medicare. Once we get into the Advantage plans, you're going to see that they also offer vision, dental, hearing in most of those plans. They're usually limited, particularly the dental can be limited. There may be some waiting periods. There might be some coverage limits. Generally, they're going to require you to use in-network providers. And often they're going to have an additional premium there. It's one of those things you really got to check with the plan. You really got to look at the details because they are all different. Next slide. So this next slide is the 2025 Medicare amounts. Part A, for most folks, you see it's a zero premium. How you earn that zero premium is either you worked a minimum of 10 years throughout your life and had Medicare taxes taken out of your paycheck, or you had a spouse who worked at least 10 years throughout their life and had Medicare taxes taken out of their paycheck. That is better than 99% of Americans, so most folks do get their Part A premium free. Then we get into these big deductibles, starting with the hospital deductible. Now, at this point, we're talking about someone who only has original Medicare A and B, doesn't have any of the parts that we're going to get into as we keep moving, the Medicare supplements, Advantage, and all that stuff we're going to talk about as we keep going. So if I just have original Medicare A and B, that hospital deductible, you see this for 2025, $1,676. That will cover you up to 60 days inpatient in the hospital. As you see, as we keep going, once we hit day 61 through 90, there's a daily copay of $419 a day. That doubles on day 91. So days 91 through 150, it's $838 a day. Most folks, however, in the real world are not in the hospital anywhere near 60 days. Generally, you're in the hospital for a few days. And if they're not able to dismiss you home, that's where skilled nursing would come in. You see the first 20 days, skilled nursing or a rehab type situation, there's no copay. And then days 21 through 100, a daily copay of $209.50 a day. I said most folks don't pay a premium for Part A. Most folks do pay a premium for their Part B. And for this year, 2025, the Part B premium is $185 a month. Now, most people who get Social Security have that deducted directly out of their Social Security. So there are some folks who are under the belief they don't pay it. Usually they do, they just don't see it come out. So that $185 a month, and you see down there is a one time a year annual deductible. This year, 2025, that annual deductible is $257. Once you have met that one time in the year, your Part B is an 80-20, where Medicare is paying 80%, you're left with that remaining 20%. The little bit in the red there says go ahead and create a personal account on Medicare.gov. You can create a MyMedicare.gov account and log into that when you go into Medicare's website. It's going to show you what's been charged on your behalf. It's going to give you reminders about different tests and screenings and that sort of thing you can take advantage of. So this next slide talks about the Medicare savings programs. These are a number of programs run by the state of Ohio that reimburse that Part B premium. So Medicare, the federal government takes that Part B premium out. The state of Ohio, if you qualify for it, puts it back in. There's a few different programs. The one for the folks with the lowest income is the QMB. All these programs will pay for your Part B premium, that $185. The QMB, better known as a qualified Medicare beneficiary, not only will that pay for your A and B, it's also going to pay for all of your coinsurance and deductibles and basically work like a free Medicare supplement plan. So the income levels, and these do change every year. As of recording this is where we're at with the income and resource levels. Income of less than $1,715 a month for a single, or $2,320 a month for a married couple. Resources of less than $9,430 for a single, and $14,130 for married. So let's talk real briefly about what that means. Income. Income is your gross monthly income. So Social Security, any sort of pension, 401k, 403b, IRA, however you're getting a monthly payment is going to count towards your income. Resources, we always say, think about your money in the bank. So what you have in your checking, your savings, and however your money is invested. What does not count as a resource is your home, as long as you or your spouse live there. What's inside of your home does not count as a resource, and your vehicle doesn't count as a resource. If you do have property other than your home, that would count as a resource. To find out if you qualify for this, to get some more information, of course, give us a call here at OSHIIP, the 1-800-686-1578. You can also go to your county Job and Family Services and get an application. They still have paper applications for this available if that's the way you want to do that. So we talked about original Medicare A and B. That's what takes the majority of time in this presentation. For some folks, that's all they have. They just have Medicare A and B. Whatever those deductibles are, the copays, they say, you know what, hopefully I can just pay them out of pocket. Other folks say, nope, I want something to make up that difference. I want something to pay for what Medicare does not. And that's where secondary insurance comes in. It comes in a few different forms. One here is group health insurance. That is if you work for an employer or a union that continues to offer you insurance that supplements Medicare. We don't see too many of those anymore. There's still a few out there. Another way to do it is Medicaid, which we kind of briefly touched on. But this is, again, Medicaid, not to be confused with Medicare. Medicaid is assistance for folks with limited income, limited resources. And of course, we talked about the Medicare savings programs, which is not true Medicaid, but it's run through the same office. The third is where we're going to spend a few minutes, Medicare supplemental insurance. Medicare supplemental insurance, also known as Medigap, sometimes referred to as MedSup. These are private insurance policies sold by private companies that work with Medicare. Now, let me say it again. Private insurance companies selling private policies. If you choose to purchase one, you're paying them a premium every month. They're coming in after Medicare pays and paying most, if not all, of what Medicare did not. A lot of these plans are very comprehensive. They're going to pay everything Medicare did not. Why are these plans so popular? No network. You can use any provider, any hospital that accepts Medicare. That's across the country. And when I say that, a lot of people think travel, but I always say, if I want to make sure I can go to any of the hospital systems in my state or in my area, if I want to make sure if there's a specialist that my doctor says, hey, I want you to see this person, I can do that with the supplement without having to check back with my plan to see if they're in network. There is a subset. We don't see too many of these in Ohio right now, called a Medicare Select plan, that generally offer lower premiums, but they're going to require the use of specific hospitals. Now, keep in mind, these plans have no open enrollment because they are private policy sold by private companies. You can enroll and you can apply for them at any time. The other reason they're popular is what we already mentioned. They pay after original Medicare. They pay after A and B comes in and pays its share. They come in and pick up most, if not all, of what Medicare did not. And with a lot of these plans, there's little or no out-of-pocket cost other than your monthly premium. These plans are not inexpensive. They're not cheap. They are, however, standardized. And standardized meaning all these companies are selling the same thing. They're sold by plan A, B, C, D, F, G, K, L, M, and N. What that means by standardized is a plan G, for example. A plan G is a plan G regardless who I purchase it from. Doesn't matter what company I buy the plan G from, it's going to cover all the same things the same way. And that's true of each one of them. A plan N is a plan N. Doesn't matter who I buy the plan N from, it's going to cover the same things at the same rate. The one big difference is going to be the monthly premiums. Even though a plan N, two plan Ns, same coverage, two different companies are going to quote me a different monthly premium. Why? Because they're private companies. They're going to set their own rate and hope to earn your business. We always highlight that because if this is something you're in the market for, whether you're new to Medicare or whether you're just seeing if there's a better deal out there, it is important to shop around because you can save a lot of money from one company to another. The next part down here talks about the guaranteed issue period. There are times where these plans are required to sell to you. They're required to sell you a plan. They can't look at your health. They can't deny you a plan. The first one here, this open enrollment, for some of us is the only one we ever get. It is 6 months when we've started our Medicare Part B at age 65 or older. So those two things have to be true. You have to be at least age 65 and have started your Medicare Part B. And the reason I say at least 65 is a lot of folks now are working beyond that. Maybe you're working and you're still covered by your employer beyond age 65, or you have a spouse that's still working and you're covered beyond age 65. It's whenever you start that Part B at 65 or older, for 6 months, you can sign up for any Medicare supplement Medigap plan offered in the state of Ohio. They have to accept you and they cannot take your health into account. They can't charge you more or refuse to cover something. And then once you're in, you're in. They can't come back 6 months later and say, oh, we didn't know you had XYZ. Too late. I'm your client now. I've signed up for the plan. The only other time that's going to come up are these special circumstances. And that's typically 63 days after you've lost coverage through no fault of your own. And that could be anything from your plan went out of business, your plan left Ohio, or you're part of Ohio. Maybe you moved and are no longer in their coverage area. Generally, you get this nice little window, a little better than 2 months, where you can sign up for any plan out there. Once again, they have to accept you and they can't take your health into account. Give us a call here once again at OSHIIP. We can look at the different plans. We can help narrow it down for you, give you some quotes. Again, that's 800-686-1578. Medicare 101. So we are 2/3 of the way through this option one. We've talked about original Medicare A and B. We've talked about secondary insurance. Some folks have it, some folks do not. The third piece with this option one, whether or not you have any secondary insurance, it is important to have a Medicare Part D plan. Part D being your prescription drug coverage. So Medicare Part D, I always say D for drugs, easy one to remember, right? D for drugs makes sense. Medicare's prescription drug coverage. It's offered by private companies, once again, that contract with Medicare. They're available 2 different ways. What we're going to talk about first are the standalone prescription drug plans. That's what goes with original Medicare. Here in a few minutes, we're going to get into the Medicare Advantage plans. They also have Part D plans as part of the Advantage plan. Signing up is the same as signing up for Part B, and as you can see, everyone with Medicare can sign up for a Part D plan. Everyone can sign up for any plan offered in the state. This year with the standalone Part D plans, there are 14 available. They're all statewide, and you can sign up for anyone out there. It doesn't matter if you take no prescriptions, you take 20 prescriptions a day. None of that matters. They're under contract with Medicare. If you sign up, they have to take you. There is a late enrollment penalty if you delay signing up, but you can see there is a number of things that count as a Part D plan. So when I say creditable coverage, what that means is it meets Medicare's minimum standards. So most employer plans, the VA is for our veterans, TRICARE is for our retired military, a lot of the retiree plans, FEHB is for the federal employees. There are a lot of plans out there that count as a Part D plan, meaning you wouldn't be subject to a late enrollment penalty. We're more thinking about the folks who don't have any coverage at all. It is important to get signed up because you could get a late enrollment penalty. And then every year you get the opportunity to look at that plan and possibly change it for the next year. October 15th to December 7th, that is the Medicare open enrollment period. Any changes you make during those 7 weeks will go into effect January 1 for the next year. And here at the Department of Insurance at OSHIIP, we strongly recommend that everyone on Part D review their Part D plan every single year. That way, because they do change dramatically from year to year, what they charge in a premium, what they charge for a copay, and even the prescriptions they cover from one year to the next can change. And it's important to take a look at it. And of course, we are here to help you with that as well. So this next slide, the 2025 Part D cost, just an overview of what's out there. I said there were 14 plans available in the state of Ohio. The least expensive one this year, premium-wise, was actually a zero premium, didn't charge anything. There were 12 other plans, and then the most expensive plan, the 14th most expensive plan, or I should say the most expensive of all of them, $124 a month. How do I know which one's the right one? It's really going to depend on the prescriptions that you take. It's going to depend on the prescriptions you take, which one's going to be the one that works best for you. And deductible, they can charge this year as much as $590 deductible. That's another place where it's good to talk to someone like us here at OSHIIP, because there are a lot of times where you're not going to be charged that deductible. You might have a plan that doesn't charge that towards tier 1 generic drugs, and maybe that's all you take. So we do have a lot of folks we'll talk to that say, well, my plan says it has this big deductible, but I don't pay anything. That's another reason it's good to speak to us. Once your plan, once you get past the deductible, however that works, generally how it's going to work is whenever you fill your prescriptions, you're going to pay a copay. The plan's going to pay the rest. And you see the 25% there on the slide. That's kind of the most you're ever going to pay is a 25% copay. Usually, particularly with the less expensive generic drugs, it's going to be a flat amount. It could be anything from a couple dollars to a zero amount. It could be a zero copay. New for this year, for 2025, you see this maximum out-of-pocket of $2,000. In the year 2025, the most that you can spend, you yourself, out-of-pocket for your prescriptions is $2,000. If you hit that $2,000, then it's going to be zero for the rest of the year. So some of you will never get to $2,000. For some of you, depending on what you take, that might be something that happens pretty quick. So that could be a big deal for you. Things to keep in mind, all the plans have a different cost and structure, and a different formulary, meaning the prescriptions they cover, and the cost based on individual drug needs, and they can change every year. So it's important to look at the explanation of benefits. It's important to look at new plans that are out there. And again, get in touch with us. You can look at them yourself on Medicare.gov. An easier way to do it is just to give us a call and we can compare those plans for you. Next slide, talking about the Low Income Subsidy. This is more commonly known as the extra help with prescription drugs. So a lot of folks will say, I have extra help. Again, it's for folks limited income, limited resources. It's a Social Security program, so it's the same throughout the country. And folks sign up for it, and they're picking from the same Part D plans everybody else is, but they're getting it for reduced or no premium, reduced or no deductible. They'll never pay more than $4.50 copay for a generic drug, never pay more than $11.20 for a brand name drug. The income and resources levels, they're going to work the same as when we talked about the Medicare savings programs, but they're a little bit higher. You can see a single person, their monthly income had to be below $1,903. Total resources of less than $7,220. Then, of course, the married is right below that. Married couple combined would have to be under $2,575, and total resources of $34,360. This is a really easy program to apply for. It's actually just an online application. It's available at ssa.gov, but by all means, you could get in touch with our hotline, and our folks would be happy to be your hands and do the application for you. It goes off electronically. Social Security will send you a letter back through the U.S. Postal Service, through the mail, letting you know if you applied, if you qualified or not. So that gets us all the way through option one. We're back to the Medicare options. A lot of folks are going to go that route. A lot of folks are going to go with this option two, Medicare Advantage. And you can see the Medicare Advantage is just the one symbol there, right? Because it's an all-in-one package, sometimes referred to as Medicare Part C. It is your hospital and your medical and your prescriptions all wrapped up in one plan. We'll move to the next slide here where it says Medicare Advantage. Available to those who are enrolled in Part A and B. They have to live within that plan service area. For most of the United States now, which plans we can sign up for are based on the county we live in. Does not mean that your doctors, hospitals, providers are limited to the county you live in. It means we can only sign up for the plans offered in our county. In case you were wondering in all those commercials why they say, oh, they looked up my zip code. That's why they're looking up your zip code. They want to know what Medicare Advantage plans you might be available for. There's no age or medical restrictions whatsoever. These, like the Part D plans, are under contract with Medicare, so anyone can sign up for them regardless of health. And it says here, alternative to original Medicare. Easiest way to think of it is it's a private company that's going to stand in for your Medicare. While you have a Medicare Advantage plan, essentially what you're saying is, while I have this plan, this is my primary insurance. I'm not going to use my original Medicare. You still have your original Medicare. You're still paying your Part B. I'll explain that in a second. But while you have the Advantage plan, anytime you go to the doctor, you go to the hospital, you go to the pharmacy, you're going to use your Medicare Advantage plan, and that's who's going to get billed. Two main types in Ohio, and really most of the country, these are the two main types, are the HMO and the PPO. HMO is a health maintenance organization. With an HMO, you have a network of doctors, hospitals, providers that you are required to use. Got to stick with your network or you're not covered. The other option is the PPO, which is the preferred provider network. With a PPO, you still have a network of doctors, hospitals, providers. It's going to be less expensive if you always see the providers in your network. But with the PPO, you can go outside of that network, see anyone who accepts that plan. You'll just pay more if they're outside of your network. So HMO kind of locked into a network. PPO, you have a little more freedom, but it's always going to be less expensive if they're in your network. Most of these plans are going to include the Part D as part of the Medicare Advantage plan. So when you're looking at the plan, you're not looking at the plan and a separate Part D plan. It's going to be an all-in-one package. Also got to make sure when I look at the plan that the prescription benefits are going to work for me as well. It says here, enrollees pay the Part B premium and any other applicable costs. There are a number of plans out there that will advertise as a zero premium plan. We are a zero premium plan. What they mean is you pay your Part B premium to Medicare, the $174.70. Medicare takes the majority of that money, sends it on to them. So you're not paying more than the Part B premium, but you're still responsible for that. The networks can change, obviously, who accepts the plan, depending on what plan you're going for. Some of the plans do have premiums on top of that, so you might have a premium on top of the $174.70. And how it's really going to work differently is instead of Medicare paying and a supplement paying with the Advantage plan, every time you use it, you're going to have copays. You're going to, when you go to the doctor, have a copay, go to the hospital, have copays, and you'll sort of pay as you use it. So you're paying less up front, but you'll pay as you go. Next slide talks about the Medicare Advantage. The initial enrollment period is the same as when you're signing up for Medicare. You can sign up for Advantage right out of the gate when you're brand new to Medicare. Every year, it has the same open enrollment as Part D, October 15th to December 7th. This is the time where you can look at your Advantage plan, make sure it's still going to be the best one for next year. Change it, drop it, go back to original Medicare, all those good things you can do during the open enrollment, October 15th to December 7th. Any changes you make during the open enrollment will go into effect January 1st. Then Advantage also has this separate open enrollment period, kind of a do-over period. January 1st to March 31st. If you come January, find yourself on a Medicare Advantage plan, whether it's a new plan you signed up for during open enrollment or one you've been on for a while, you can still switch first 3 months of the year. You can switch to another plan, or you can drop it all together, go back to original Medicare. Any changes you make there will take effect the first of the next month. So if you drop your Advantage plan in January, those changes will take effect February 1st. It's just a little bit of a do-over period. Next slide talks about 5-star plans. There are a few plans this year in Ohio that have been rated 5 stars. What that means is Medicare, CMS, has rated them, all the plans are rated 1 to 5 stars. These are the plans that were rated 5 stars. If they're rated 5 stars, they're going to have that little symbol there, the star with the 5 in it and the golden triangle. What that means is you can pretty much sign up anytime during the year. They have that 1 week, it's a little tricky, but you really can pretty much sign up for them anytime during the year. The caution we like to throw out to folks is we don't want you to see 5-star and think, hey, that's a no-brainer, sign me up. It's still important to make sure that your doctors accept that plan, to make sure the hospital accepts that plan, to make sure it's still going to cover all your prescriptions, and what are you paying out of pocket for all of that. Still got to take a look at it to make sure it's going to be a 5-star plan specific to you. Next slide, the what the heck are they selling? So these ads are on all the time, right? And once you're getting close to Medicare age, whether or not you're intending to sign up or not, you're going to get ads in the mail. You're going to get phone calls, which you're really not supposed to get, but you're going to get them. And of course, these ads are on all the time. We are state of Ohio, we are not able to say, hey, don't call these 800 numbers. I will say that generally when you're calling these numbers, you're not speaking to someone in the U.S. You're not speaking to, certainly not any local agencies, so to speak. You can call these numbers if you want. We won't stop you from doing it. But there are local resources out there you could reach out to first. You could make get the information and make a good choice. I strongly would discourage doing business with someone who calls you out of the blue. If you called them, that's a different story. If they're calling straight out of the blue for you, I would at least do my due diligence to make sure who I'm speaking to is a legitimate agent or agency that's out there and licensed in the state of Ohio. Moving between options, we're going to look at this a couple different ways. Going from a Medicare supplement to a Medicare Advantage plan. Anytime we have an open enrollment period, you can do that. Every year during the open enrollment, or if you have a special enrollment, we can do that. From a supplement to a supplement, going from a supplement Medigap to a supplement to another supplement Medigap. There's not an open enrollment for this, except for that first time when you're brand new to Medicare. So you can actually enroll for a new plan at any time. But remember, if I'm not in a guaranteed issue period, they're going to look at my health and they can deny me. So we're never going to discourage someone for trying to apply for another plan. Just know you may not always be successful. Advantage to Advantage. Guaranteed issue anytime that enrollment is open. Anytime we have any sort of open enrollment, you can always go from an Advantage plan to any other Advantage plan offered in your county. Medicare Advantage back to a supplement. Again, if I'm not in a guaranteed issue period, I can always apply for the supplement. I may not always be able to get it. Then the at a glance is probably going to look pretty small on your screen, but it kind of breaks down some of the differences between if I went with original Medicare with the supplement and a Part D, or I went with a Medicare Advantage. The big ones there are cost. It's going to cost me more every month with a Medicare supplement. I do, however, have my choice of provider. I don't have to worry about, is this provider in my network, out of my network? And I would need to purchase a separate Part D plan. With the Advantage plan, it's generally going to cost me less per month. I'll still pay my Part B premium, my $174.70, unless I qualified for a Medicare savings program. And maybe that's all I'm going to pay. But I do have a network to deal with. I do got to see providers in my network, or if I'm with the PPO, go to providers who, at least accept my plan. But I may have some added benefits there again. There could be vision, dental, hearing, fitness memberships, all sorts of stuff they could add in there as well. And it is going to include my drug coverage. So that gets me all the way back to knowing your options. So we're going to end where we started, so to speak, talking about Option 1, original Medicare, secondary insurance, Part D, or Option 2, Medicare Advantage. To sum it up in a couple sentences, with Option 1, you're paying more upfront. You're paying more in premium at the beginning of the month. What you're getting for that is no network and not a lot of bills, because the supplement's going to pick up most, if not all, of what Medicare did not. With the Option 2, the Medicare Advantage, you're going to be paying less every month. You'll still pay your Part B premium, but maybe that's it. Maybe the Part B premium is all you're paying. You will pay as you go. You will pay a copay anytime you go to the doctor, a higher copay at the specialist, a copay the first few days in the hospital. So you have the potential of paying more as you go. Keep in mind, when you're new to Medicare, you can sign up for anything out there. Moving around, most things you can move around. The supplement's the only one that's tricky there. OSHIIP, the Ohio Department of Insurance, we're here to help you every step of the way. Don't ever hesitate to reach out to us. And then our next to last slide here is protection against Medicare fraud. Most agents, most agencies are good folks who are trying to do the right things for their clients. Unfortunately, we do have some bad actors out there, and we do have some folks who break the rules unknowingly or knowingly. Couple things they cannot do. Door-to-door sales. They should not be showing up at your house or your apartment unless you made the appointment. Unless you made an appointment for them to come, they shouldn't be there. They shouldn't be giving out cash gifts or gifts exceeding $15. High pressure sales tactics. Generally, it's one of those, you know it when you see it, right? Misrepresenting the plan, giving incomplete information, or the big one there, representing themselves as Medicare. Medicare is not making outbound phone calls to folks. They're not sending you text messages. They're not sending you emails, ever asking for any of that personal information, asking you to click on links. That's not how Medicare does business. If they need to reach you personally, they're going to send you a letter through the Postal Service, through the U.S. mail, telling you to contact them. Everyone else who's claiming Medicare is lying. They're not being honest here. The last bullet point here talks about Pro Seniors. This is a group we partner with all over the state. They're actually a national agency, the Senior Medicare Patrol, who's there to help folks, seniors who have become victims of fraud, waste, and abuse, and they're there to help the consumers out. The very last slide now, it says questions, but I wanted to bring it up just because it has all of our contact information on it as well. The OSHIIP, again, the OSHIIP hotline, 7:30 to 5, Monday through Friday. There's the 1-800-686-1578. You will speak to actual people in Columbus, Ohio, who, like myself, are state employees who are here to help you however we can help you out. There's the general email mailbox, our website, and our online counseling site. The other ones up there are just the 800 Medicare and, of course, the 800 number for Social Security. Please reach out. Any questions, any way we can help you out. That is what we are here to do, is to help Ohio consumers get through this. So with that, I thank you all for taking this time to listen to me. Please don't hesitate to reach out if we can help you in any way. Good luck and have a great day.